Good afternoon. We're going to get started with our lunch keynote. I'm Paul Fronston, Director of Health Benefits Research at EBRI. It's my pleasure to introduce our lunch keynote speaker, Robert Andrews. Rob Andrews currently serves as the CEO of the Health Transformation Alliance, also known as HTA. As CEO of the HTA, Andrews oversees the strategic direction of over 60 major corporations that have come together in an alliance to do one thing: fix the healthcare system. There is much more detail about what Rob has accomplished at the HTA in his bio, which there's a link to on the EBRI website. I encourage you to read it. Rob served as a member of the U.S. House of Representatives for nearly 24 years. Upon his departure from Congress, President Obama praised Andrews' service as, I quote, an original author of the Affordable Care Act and a vital partner in its passage and implementation, and cited his tenacity and skill in representing the people of New Jersey. Rob holds the record for the highest number of votes ever received by a U.S. House candidate in the history of the state of New Jersey. Again, I encourage you to look at his bio. Please join me in welcoming Rob Andrews.
Thank you, Paul. Good afternoon, ladies and gentlemen. I'm really honored to be part of a program that has heard from so many leading lights as we celebrate the 50th anniversary of a law that has done so much good for so many. And to Barb, to you, and to Jim and Paul and others involved in planning this program, what I've heard this morning, I can tell you that some of the most famous members of Congress were with us this afternoon. They'd be bored to tears and totally disoriented as to what to do. I can think of no higher compliment to you than the fact that the program reflects that. I mean, who would think that gathering a group of serious-minded experts who've been involved in the writing and administration of a major law to talk about substantive policy, who would ever think that that would contribute to the national debate in any meaningful way? I don't see any tweets coming out of this. I haven't seen anything go viral yet. I'm not finished. But it really is, it's a pleasure to be part of something this important. One of the unfortunate tropes in American culture has become people who are career civil servants who serve because of their belief in the public good and who sacrifice considerably for the public good are now regarded as the deep state. And then a lot of other people who are professionally trained and who work very hard and sincerely advocate for points of view for clients and those who are part of groups that they're in are regarded as the swamp, the lobbyists who are Satan's army here in the nation's capital. I wish more people could see just how wrong that is. And this morning's conference really lent much credence and support for the proposition that people who are deeply skilled, who care a lot and know a lot, can contribute so much to the development of the country. I know a little bit about the difference between what you're called and what you do as a former member of the House. That when I was first elected in 1990, obviously there was no internet. I was in large part responsible for creating it during my tenure. There was no internet. That people communicated by phone calls and mail. And I had an Aunt Roberta in California, for whom I'm sort of named. And the family helped her follow the campaign from afar. I was from New Jersey. She was in California. And she would get news clippings that people would clip out of the newspaper. For those of you under 40, a newspaper is a piece of paper that you buy and hold in your hand. But they would send her news clippings, and she kept up with the campaign in that way. And after I was fortunate enough to be elected, I called her and said, Aunt Roberta, I have great news. I won. I'm going to Washington, D.C. I'm going to be a United States congressman. And she said, oh, Rob, I'm so proud of you. I'm so happy for you. Imagine how good that's going to look on your resume when you go to apply for a job someday. So what we are called and what we do are two very different things. And what so many of you have done in this room, and I hope will do in years to come in this room, is to use this artfully drawn statute for the benefit of good, so that the people that Bob Johnson talked so eloquently about this morning, the single mom whose refrigerator breaks down, is not in the peril that she finds herself today because she has some savings to lean back on. Or that a person who gets the dreaded news that there are some problems early in her pregnancy and that she really desperately needs to know where to go to have a successful course of care in that pregnancy so that the baby's born healthy and that she's healthy, and just doesn't know where to turn or what to do. These are the people that you are helping, and these are the people we can do more for. So to me, the discussion about ERISA is a discussion about the principles on which it's formed, the policies that should inform it in the years to come, the potential that the proper application of those policies could create, and then the promise, the exhilarating promise of aspiration, if we do the first three things that I said, how much better we can make it for so many people. The principle of ERISA echoes a hugely important principle more generally in American history. An ancient phrase, which no one ever uses anymore, but you can read about it in the history books, is that in the early days of the Republic, before the Constitution was enacted in Philadelphia, about a decade or so after the 11 years, I guess, after the Republic won its independence, that's worth about as much as a continental. Has anyone ever heard that phrase before? It's an archaic phrase, and here's what it relates to. The currency that the colonies used during the Revolution and tried to use for a period of time after the Revolution was called a continental. And it quickly became worthless because of inflation and because of other problems that happened. And its worthlessness, the inability of the government under the Articles of Confederation to produce a stable currency and therefore a stable economy, in part led to the Constitutional Convention, which led to the Constitution under which we live today. The principle of that Constitution and its attempt to fix the currency problem was that a seamless economic market would best serve the cause of economic growth and prosperity among the colonies. So one of the first things that went into law after the Constitution was ratified was the Coinage Act, which took advantage of the new constitutional authority of the Congress and the executive branch to create and enforce a currency. And that led to an uneven, inequitable, but fairly steady story of growth. Last thing I looked at in my news feed, after searching again for how some of the members of Congress would feel about this, last thing that I look for, I noticed that the Dow hit 40,000 for the first time this afternoon. Now it'll be back to 28 or something by the end of the week. I get that, but I believe there is a direct connection between the decision of the framers of the Constitution to empower a central government with the ability to create a seamless market among the colonies and the great wealth that has been created, though inequitably distributed, created since that time. ERISA does the same thing. It creates a powerful interstate market, a uniform, seamless market, so that when people think about saving and investing money, or when employers think about providing health care, they can do so under one dependable, predictable, uniform set of rules. So the principles on which ERISA are founded are really, in my view, the prescription for successful policy about anything. The first is ERISA creates a market, a seamless interstate market. And the second thing it does is to impose on the players, some of the players in that market, a fiduciary responsibility to the people for whom they are accountable. And if you think about the best things that have happened, in my view, in American history, Social Security reflects the same principle. A national, retirement floor, a retirement guarantee that is handled, sometimes mishandled by the elected officials as fiduciaries for the retired people of the country or the disabled people of the country. The things that we've done best have followed that principle. Look at the miracle of telecom, which I had the privilege of voting for in 1992. And before 1992, there was a local phone bill, a long distance phone bill, a cable television bill. If you had a computer, any sort of computer capability, a computer servicing bill, et cetera. And in 1992, almost unanimously, things used to be this way. The Congress passed the Telecommunications Act that wiped out those verticals and said to Verizon didn't exist then, it was called Bell Atlantic, but it said to Bell Atlantic and to Comcast, a small cable television operator in suburban Philadelphia at the time, go compete with each other. Go find the best way for people to take photographs of their lunch and send it to people and their families. But go make it possible for people to communicate with each other in such a powerful way. Seamless markets that are well regulated work. And that's what we've been given a chance to do with ERISA. Now, in terms of public policy, where there certainly will be debates that go on, I think you go back to the well-articulated principle, it may have been Cicero who said this, if it ain't broke, don't fix it. Preemption is the crown jewel, Phyllis, of ERISA. And it is preemption that the trade-off is, and it's a brilliant trade-off. The trade-off is if you want preemption, you must earn it by acting like a good fiduciary. That's the trade-off. And I think everything we do, every piece of legislation that we see thought about or offered at the state or federal or local level should be viewed for that prism. So let me offend my friends on the left side that as much as I understand their concern about the ever-rising cost of pharmaceutical products and their desire to do something about it, when I see state governments, in some cases city governments, impaneling drug price regulation boards, it worries me because I do believe it's an impediment to that seamless market that we need to prosper. I'm not sure that the vaccines that lifted us 4 years ago from this meeting 4 years ago would have been a huge Zoom call. None of us would have been here. If we went to the supermarket that day, it would have been with a mask. My wife used to go with like a mask and a moon suit on because she was so worried that we'd get infected. I'm not sure that the vaccines that made this meeting possible would have been invented if there were 51 separate price fixing boards for pharmaceutical products. I'm not sure. And so to my friends who on the more liberal side who want to do that, I would say, let's be really careful. To my friends on the conservative side who want association health plans, they've wanted it forever, they still want it, it's what they think is good. That to me breaks the covenant because it says that I believe, and I think the framers of ERISA believe, that if you want the benefits of preemption, you must earn it by being a good fiduciary. And by stripping away certain protections that federal law provides, I think it violates that covenant. So I would urge the Hippocratic Oath, I did know who said this one, Hippocrates, first, do no harm. And I think every provision that we think about with ERISA needs to be looked at through that prism. Preemption is not just a technical statutory legal phrase or construct. It is a powerful dynamic that creates the market that I believe has served us unevenly, but well. Which then leads me to the point of what is the potential of what we could do with ERISA. And I heard Mr. Johnson this morning talk about the potential of working within that framework to remedy what I think most of us agree is an inexcusable variation of wealth based on race in the country. He probably could have added to that rural status, gender, and certainly some other qualifications or other conditions, I should say, as well. The same is very much true in healthcare. I think to understand what we can do with the U.S. healthcare system, you have to understand what has been done and what has not been done in our time working on this. What has been done is the vaccines that ended, for all intents and purposes, the pandemic. Think about this for a minute. I mean, we were in a place, again, 4 years ago where life had stopped. And what happened, and I think the Trump administration deserves credit for laying down this challenge. The Biden administration deserves credit for making sure it was implemented. That's a rare, and Sona City's probably never said that in one sentence before, but I think it's true. The Trump administration said, listen, pharma industry, whomever can create a vaccination that's safe and effective will buy every dose. There was a powerful incentive to get the right thing done, and it got done. Compare that to the unbelievably growing problem, no pun intended, of obesity and type 2 diabetes, the problems that come with it. By any objective measure, it's worse than it was before the Affordable Care Act, before Medicaid and Medicare were passed. It just keeps getting worse. And I think the difference between the success in the creation of those vaccinations and the failure, in which we all share responsibility, is the fact that the incentive for the industry to create the vaccines was clear, dependable, and real. Who has the incentive to attack the obesity problem? Is it carriers? Not for self-insured employers, it's not. Maybe for themselves if then they're fully insured, but they only have lives for a typical duration of 14 months. Do you want to pay to renovate a kitchen of a condo that you rent or one that you own? Same can be said for Medicare Advantage patients, where 27% of them switch plans each year. Does Medicare have this incentive? Sort of, but Medicare recipients are voters, and people who work for health systems are voters. And anytime that you disrupt and say, you know what, we're going to start steering people toward the providers in the country that best prevent obesity and away from those who don't, there would be a National Association of Obesity Producers that would be formed immediately. And they would write to people like I used to do and say, how dare, Uncle Sam in Washington interfere with our business and your job? And it would be very, very, very hard to do through Medicare. Same story with Medicaid. So what about employers? And that's why those of us who work together on HTA are engaged in this. And we have many brothers and sisters in this marketplace. Business groups on health and other national associations who spend a lot of excellent time and thought in making this possible. And so many of our members here today, Paychex is here, Health Equity is here, Prudential is here, Shell is here. We're proud that all those companies are part of what we're doing. What we're trying to do is to make the incentive structure for everything be like it was for the vaccination. As many dollars as we can put behind care providers who cure illnesses and create great outcomes, that's what we're trying to do. We're growing. We're a little above 70 companies now, and we by no means can be the dominant force in this market, but we can be a catalyst. And for our members who are most actively engaged in what we do, if you want to use hospital readmissions as a measure of quality, and it's an uneven one, but it's a pretty broadly accepted one, our most engaged members have hospital readmissions on a risk-adjusted basis, 29% less frequent than those who are not involved. Total cost of care, about 15% risk-adjusted less than who are not involved. Now, we want this to be really clear. None of our members says, oh, let's do healthcare on the cheap. Let's save a lot of money because Mary over here is pregnant. No, well, what they want to say is, what can we do if Mary is that person who hears early in her pregnancy that there's a high risk of preterm birth? What can we do to help her? How can we best intervene for her so it is more likely that she will have a full-term or near-term birth, the baby will be healthier, she will be healthier, and yes, they'll both cost less to take care of. The issue is this choice that we can either spend a lot of money and take good care of people, or spend less money and not take very good care of them is a false choice. We believe what can and must be done is that we must, through taking better care of people, through doing that, that we're be in a position to save money as well, which leads me to the final point, which is the promise of what could happen if institutions work together. With the kind of public policy I talked about, with the kind of market player effort that we're a part of, I truly believe this, that there are children born this month who may live to be 200 years old. Now you say, and I really hope to be there at their birthday party too when that happens, but you might say, well, that's fantastic. I mean, that's sort of out of science fiction. My father was born in 1910, about 4 years, I think, after the Wright brothers had first flown an airplane. By the time he was 59 years old, he and my mother and I watched Neil Armstrong walk on the moon on television. That's what happened in 59 years of his lifetime with computing capability and data sets that are tiny scintilla fraction of what we have today. So do I believe that all genetic medicine will work right away? I do not. But I know that 2 children who were congenitally blind just last week had an experimental genetic therapy and they could see. That happened. I know that livers, which is the one organ in the human body which has regenerative capabilities, that and the memory I sometimes think, but it has regenerative capabilities, that there are drugs very close to the market here that would go far deeper into a liver infection and restore that regenerative capability for that organ. Is every one of these attempts going to succeed? I promise you they will not. But I feel even more strongly about the promise that if we have a system that directs incentives toward those who are trying to achieve great outcomes, these things will happen. A diagnosis of childhood leukemia used to be a death sentence. Now it's, for most families, a manageable disease. So that's what we can do. That's what we can do. And I think that each one of us has a chance to contribute in our own way to that, because the very wise framers and implementers, the Hall of Fame that you've seen up here today, wrote and executed on a law that created a seamless national marketplace that empowers men and women with resources to invest them in a way that achieves great, great outcomes. No one will tweet that today. You won't see it on Rachel or on Hannity tonight. But it's the serious work that goes on here by very serious and accomplished people. And I'm really proud to be associated with them and grateful for all that they've done. Thank you very much. Thank you.
There we
I
go.
see one back there, Paul.
Oh, 1 second.
Curious for your thoughts on AI and if there's any kind of near-term opportunities.
AI is going to change the world in everything, healthcare especially. We prefer not to use the word AI because it sounds like some robot is diagnosing your mom. We prefer to think of it as enhanced intelligence. We think that the combination of a smart, well-trained provider, a doctor, a nurse, a therapist, plus the incredible power of generative AI is going to solve problems faster. One of our executive committee members, our chairman, is fond of saying that AI asks better questions sooner. And that's what we think is going to happen in healthcare. Now, one thing that we insist on, and we're encouraging all of our employers, and I think all of you are doing this to insist on this, is that AI needs to be a tool in the hands of competent men and women, not a replacement for competent men and women. But I think it's going to expedite the genetic medicine, the regenerative medicine, the miracles that I made reference to. I think AI will be an incredible force behind those changes. Paul?
Rob, you've got at least what, 9 million covered lives in the Alliance?
It's
More than that?
5.5 domestic, about 8.5, 9 internationally.
Okay,
Yep.
and that makes you what, like the 13th largest state in the US?
I guess I'm the governor of the 13th largest state in the US. Where's my state police escort? Yeah, it does actually. I think we're actually the 6th largest buyer of healthcare. Behind obviously Uncle Sam and Medicare, the states and Medicaid, the FEHP. But I think we're the 5th or 6th
Yeah.
largest. Yeah.
Most employers would jealous of clout, right? Even the largest employers, because they don't even
Yeah.
come close to where you are. Can you discuss how your size in the context of ERISA has made it easier for you and your members to get the kind of numbers that you mentioned on things like hospital readmissions?
Yeah, it's helped us in 3 really important ways. The first is we get to listen to the men and women who are where the rubber meets the road. Andy Gregg is here today from Prudential, and his job every day is to get better results from Prudential. And we get to listen to him and his peers, and we learn from doing that. The first thing is the knowledge of the people actually doing the work, not the whiteboard people, not the political people, the people actually doing the work. Second, data. Every member of the HTA contributes de-identified claims and demographic data to a data aggregate that we use. It now has north of 4 million lives in it. And it lets us see, I won't give you the answer, but you'll see it soon. I wonder if GLP-1s really reduce the total cost of care. Wonder if they're overpriced or not. Well, we don't really have to rely upon a survey that a drug manufacturer paid for to answer that question. We can see for ourselves. And that is a very powerful tool. And then thirdly, yeah, like anything else, that you get a better deal on cases of water by being a Sam's Club member or Costco than you do if you're not. And again, I would make this really clear. None of our members wants the cheapest mammogram. They really don't. What they want is a provider who is really skilled and really compassionate for the person getting that mammogram, but they absolutely want the best price they can get for it in the first value. So like with anything else, it's why the union movement happened, right? Collective bargaining works. If you have a like-minded group of people who are willing to understand their own differences and disagreements. Another cardinal principle for us is that Andy Gregg runs his health plan at Prudential. We don't. But we're a tool that he can use for that purpose. But we're an option for people that they run their own plans, obviously.
Rob, I think we're out of time. Thank
Yep.
you so much.
Hey, thanks very much, everybody. I appreciate you.